meeting is being recorded and will become part of public record. Those wishing to comment when the chairman allows, please use the raise your hand function at the bottom of your screen. Mr. Chairman.
Thank you, Robert. Morning, and I'd like to call to order the prison board meeting May 20th, 2020. And ordinarily we would ask for public comment at the beginning of the meeting, but in this case, since we're doing this remotely, I'd like to ask if questions could be held, and they will be recognized after the warden's comments, because many questions that you have may be answered during his report and other department reports. So that's the way we'll proceed. And before we get into department reports, I'd like to ask for an approval of the minutes of our January 16th meeting.
So moved.
I'll second.
It's been moved and seconded. Any questions or comments or additions or deletions? Hearing none, all in favor of the motion, please indicate by saying aye.
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 Opposed? So moved. The second action item that we have is ratify the hair policy, I'll call it, for a better term, that we passed on April 23rd. We need to ratify that because we did a phone polling of people, members of our board, and it was passed so that it could be put into place, but we need to ratify that. So I'll look for a motion to approve that.
Should that be read, Commissioner? Mr. Chairman, should we read it first?
Well, it's a, how about if I'm not sure what, the answer to that. We're voting, and so we're ratifying it. We can post it, you know, it's already passed, so I don't know that we need to read it. It's quite lengthy. Pleasure of the board.
Yeah, I would say exactly that. I don't believe there's any formality or requirement that the policy be read. However, if, again, we're looking primarily for a motion, a second, and then a vote, just affirming again the policy that was enacted by the conversations and communications of the board with me directly as solicitor. But I don't believe there's any requirement for it to be read. If any member of the board would like that to happen, it's certainly your discretion as chairman to allow it or permit it.
Was the policy ever posted anywhere publicly prior to this?
I'm not aware that it was. I'm also not aware if that's a standing procedure of the prison board to normally circulate that publicly. Although again, it would be a document that can and will be made available just upon request or a right to know law request.
We can do that. Okay. I'll seek a motion to approve the hair policy.
I'll make the motion to approve the hair policy of record.
I'll second it.
I do have a question before we vote. Warden, is this wording pretty much in line with what the state corrections policy is? Is that mirrored?
Yes. This policy was actually a recommendation of our liability attorney because of the two pending claims that were filed by inmates. So this policy is congruent with the standard across the nation, and it was under the recommendation of our liability attorney, Matt Clayburger, that this transpired.
Any other comments or questions regarding the motion? Hearing none, all in favor, please indicate by saying aye.
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 Opposed? So moved. Okay, thank you. Now we'll go into the department reports and speak or start with the departments.
I have nothing to add to the 3 months of reports that were submitted to you, Commissioner, and board members regarding everything that has been outlined in my report, especially with the closing of the county. Obviously, the prison hasn't closed, but I'd be more than willing to entertain questions as to what's entailed in those reports from it would be March's reports, April, as well as this month's report. A lot of the reports are detailed, some of them aren't, but I'm more than willing to answer any questions that were provided in those reports.
noticed in the reports that prime care was very prevalent in most of the department reports in terms of lots of meetings, lots of conference calls. And they certainly have stepped up to be good partners in this. And is there anything from their point of view, Warden, that you'd like to share, or is there?
Well, right now, actually, I'm in this meeting because Prime Care is conducting a meeting with my other administrative staff right now, where we had, we were having daily reports, especially with the pandemic issue. When our first case was put into play, which was on April 24th, that was our first detected case. And we were having daily conversations with not only on-site prime care staff, but also the corporate staff. So I can't express my gratitude and thanks for them for actually getting ahead of this. And fortunately, us as a facility, and I credit staff for that as well, have bought into all the precautions that have been put forward, as well as the inmate population have bought into it, even though frustrated. We started at the beginning of March, shortly after the county decided to close, and a lot of those precautions have led to, and I'm cautiously optimistic saying this, a lower rate than anticipated at first, but obviously we feel that that's not over yet, especially when the court opens up at the end of the month. We'll still have to be mindful, but considering that, yes, prime care has really mitigated and headed off, and and there's a lot of other factors involved in that, as well as the courts, Judge Stillwalk, as well as Judge Stillwalk and Stephanie Zarlos. They really assisted us, and the local law enforcement community as a whole have been very empathetic with that, and our population has significantly reduced. That's no secret. We're actually at a 46% reduction of inmates. In January, we were around 442. Today's population is at 253, and we've been as low as 243. We expect that number to go up as the court resumes to normal activity, but as that proceeds, there's a lot of other things that we already have in place, and a lot of things that we put in place to mitigate. Prime Care has been there right with us all the way, and I can't thank them enough for that.
Mr. Chairman, I noticed in the participants, their Prime Care Medical LCCF is here, and there's also someone identified as Tom. I don't know if it's Tom Weber, Prime Care, but I'm just pointing that out in case at some point in the meeting you want to go to them, give them an opportunity.
Well, certainly our hats are off to your entire crew down there and everybody that's participating at any level, because it's a tough environment, and it's been a long time getting through all this. So, we're not out of it, but you're certainly doing well with it as far as we've gone. So thank you.
I have two questions.
Yes, go ahead, Commissioner.
Thank you. First, how many active positive cases are within the prison walls at this time?
We have 11 cases. We had as many as 19 inmates, and actually 5 staff. And those staff were 4 prime care staff. We've had a total of 9 individuals of those 24. 9 individuals have recovered. 3 prime care staff have returned to duty, and we have one prime care nurse that's still out, and we have 1 correctional officer that has been quarantined. But fortunately, the individuals that were actually tested positive are all, as I've just been informed by a prior meeting, that they are asymptomatic. They're not symptomatic, and their symptoms were minimal, which I'm thankful for that. And like I said, of those 24, 9 have recovered, and of those 6 inmates that have recovered have been put back in population. And after the standard quarantining process, which is 14 days, and then another additional 7 days, because as I understand, after 14 days, you're still shedding the virus, and but you may be recovered, but you could still be a carrier. So they're going an extra 21, actually total 21 days, and we've done a lot from that standpoint.
Of the ones that are active in the prison right now, how many are
Yes.
staff and how many are prisoners?
we only have one staff member that's currently quarantined at home.
Okay. And then my second question is, I see in your report that you've distributed a newsletter to the inmates. Is it
That's a prime care newsletter, Commissioner.
Oh.
It's one that they formulated as strictly educational when they began surveillance checks of, they ramped up the checks of the inmate population. So to mitigate fears and the psychological factor associated with any pandemic, obviously those individuals that are incarcerated, they want to make sure they had the best opportunity to be educated, as well as being provided with the PPEs necessary to, to mitigate any further spread of the virus within the facility. So that was a sole initiative started by Prime Care. I thought it was an excellent one, and the newsletter that is formulated and still being formulated and distributed. It's distributed to all inmates, not just in the area.
Could we, as a board member, request a copy?
Sure.
Okay. I'd appreciate
No,
it.
Yes.
How are your supplies holding up, soap and masks, etc.?
We're in very, very good shape. In response to our mail policy that was put into place over a year ago, we had stocked up significantly on PPEs for totally different reasons, not even realizing that we were going to be affected by something like this. So I think we're in very, very good shape as far as cleaning materials, PPEs, things of that nature. In fact, just yesterday, we actually sanitized 13 areas of the facility that were unaffected, but just as a precautionary measure by a company called Environmental Hazard Control. They've been used in Lancaster County. They're used in hospitals to sanitize. It's actually a fogging unit, and we moved inmates outside. Thankfully, the weather cooperated, so we could move the inmates outside and sanitize 13 actual housing areas within the facility as an aggressive measure to make sure we continue to mitigate whatever we're facing down the road.
Nice job.
Any other questions? Any other questions for the board? Okay, I think in the department reports, we all received those electronically. I'd like now, if there's no opposition, I'd like to open it up for public comment. Robert.
Anybody wishing to comment, please use the raise your hand function. I have one raised hand. I'll bring them in now.
Hi, good morning.
Morning, Laura.
Morning.
Hi. Warden Kearns, if this doesn't broach any sort of confidentiality issues, has the COVID-19 infection been equal amongst male and female inmates, or more men or more women?
It's been pretty equal up to this point. I would say it's pretty equal based upon where it has been detected. It's been primarily segregated to inmate workers that had contact with many touch surfaces within the facility. So what we did when we identified it, detected it, what we did was we actually prevented movement from within the facility and started hiring inmate workers within their respective housing units to mitigate the further spread. And that seemed to work, where those individuals living in a specific area would be paid as inmate workers and be responsible for the cleaning of their respective areas. And it seemed to halt what before we would hire institutional work crews to go throughout the facility. But we prevented that travel. So what we did to mitigate it, we actually, so to answer your question, Laura, the spread has been about equal as far as in numbers standpoint, right, to this point.
And did I understand you correctly that the patients or the inmates that currently are infected were asymptomatic?
Yeah, that's correct. That's correct. Well, not when detected. I don't mean to misrepresent that. When they were detected, they presented some type of symptom which prompted the testing. But I'm saying at this juncture right now, the last report is all that are quarantined, going through the quarantine process, are asymptomatic at this point.
And so the only inmates who get tested currently are those that present with suspicious symptoms?
That's correct. That's correct right now. We are in discussion with our healthcare provider about, for lack of a better term, global testing within the facility. But that's still an option, but we haven't made any decision. That'll be solely up to our healthcare provider.
Okay, thank you, Warden.
You're welcome.
May I follow up on a clarification question?
Sure.
Of course.
Thank you. Warden, because there's probably 4-to-1 males to females in the prison, I'm unclear if your equal percentage is of the percentage of inmates or actual numbers like 3 and 3.
Yeah, actual numbers.
Okay.
No percentages at this point.
Okay, thank you.
You're welcome.
I don't have any additional raised hands.
Okay, anything from the floor?
Can I just add a clarification, just or add on, I guess, to something that the warden mentioned about the testing? There was, warden, I think this is correct, back when you had initial positives, the first of the positives, there was some testing done of the inmate detail crew,
Oh, yes.
just in case there was asymptomatic spread, which, so, it was sort of the same, the population that shared the same space and circulation as those who showed positives were also tested as a precautionary, so you could really contain it.
That's correct. Thank you for bringing that point up. If someone was actually tested positive in a specific area, the whole area was tested, and so we knew who we were dealing with, because at the current juncture, we, as a recommendation from our healthcare provider, we split our work crews to make sure that if one got infected, the whole work crew wasn't taken out. So, and we're still practicing that as well, and just as a precaution, because we feel once the courts open up at the end of the month, we're actually considering testing everybody that comes into the jail. That way, that would alleviate that quarantine process, and we'll be able to manage the population a lot better without waiting a 14/21 day period.
I do have 2 more questions. I was wondering, I see that we have 26 state sentenced inmates in the prison and 0 have been transferred. And I understand that's probably because the state is not accepting any new inmates transferred in. But are they helping to pay for those state inmates that we are housing for them?
They're not state inmates unless they actually get state ID numbers. A lot of them have been sentenced to the state, but until they're actually introduced to the state system and assigned a state ID number, they're still a county prisoner.
So that's an additional expense for us.
It is, but at the end of the day, the state is taking inmates. They are taking transfers, and we will be having inmates slated in the near future for transport. So that that moratorium is off right now.
Okay, and then my other question is, I know in the news right now they're talking about the medical marijuana. Is that inmate still incarcerated? That it's part of that lawsuit, or?
That I don't know. I don't know what. I'm not sure what the inmates who you're referring to at this point.
The one that filed the suit that we changed the policy on is what you're referring to.
Marijuana?
No, medical marijuana. That was Judge Tillwalk's decision for people on probation.
Yeah, it was a parole issue.
Yeah, for probation.
So it was, okay, so they were never incarcerated.
No, that's one claim. I'm not a defendant.
Okay, thankfully, huh? Thank you.
Okay. Anything else for the good? I'll entertain a motion to adjourn.
So moved.
Second.
Thank you. We stand adjourned. Thank you all.